Hi, my name is Jane Brady and I'm the Senior Lead Nursing Informatics Specialist for Betsi Cadwaladr University Health Board. And that's been a huge learning curve, but it's a very exciting role and I'm really pleased to have actually been given the opportunity to develop into this role within my health board. So part of my role, or one of the main aspects of my role currently, is to implement the Welsh Nursing Care Record across Betsi University Health Board. This is a massive change for us in Betsi. We're very paper-based processes, and I'm really excited about this work and rolling it across our hospitals. We're the largest health board in Wales, so it is going to be a bit of a challenge geographically, but I think I'm excited about making the change to move forward. Having done engagement so far, the nurses themselves are excited. They are desperate to get their hands on an iPad and to start doing their paperwork digitally instead of trying to look for reams of paper and then hunting through the case note to find the information that they're looking for. Obviously, with things like this, there is a big change in the way of working. There is a lot of apprehension, and part of what I'm doing from a personal level as part of this rollout of this project is to look at the digital skills of the nursing workforce and how we as a health board can actually build up that skills and confidence with using technology. So just using a mobile device, using an iPad, using a computer. And I think the Welsh Nursing Care Record being one of the first big digital systems for nursing to come into our health board will give me lots of guidance on how we can champion improving to digital skills within our organisation for nurses. For me, we're at a very exciting time in BCU currently, because we are planning to go live hopefully the first week of March with the Welsh Nursing Care Record, and that will be in one of our community hospitals. We've started that engagement and had conversations and trying to get plans in place, and the feedback that we're getting currently is that everybody's really excited about it and feel that it's been such a long time coming that they can't wait to get going.